There's a hidden truth most people over 60 will never hear from their doctors. Every year, millions of seniors dismiss a moment of clumsiness, a word that vanishes from their tongue, or a sudden dizzy spell, as just another senior moment. But what if I told you that some of these moments aren't a normal part of aging at all? What if they are the quiet whispers of a hidden stroke, a silent event happening deep inside the brain? New studies from the American Stroke Association are revealing that for every person who suffers a major, obvious stroke, 10 or more may be having silent ones. And shockingly, 99% of people have no idea it's happening until the cumulative damage is done. You won't hear this from your clinic. You won't see it on a billboard. But the truth is buried in the science. And today, we're uncovering it all. In this video, we'll explore the 5 silent stroke signs most seniors ignore and the terrifying truth about what they mean for your brain's future. All backed by real science, and you won't believe what made it to number 2. Before we begin, let us know in the comments below where you're watching from and your age. Have you ever brushed off a strange symptom as just getting older? We're reading and replying to every single comment. And don't forget to like this video and subscribe to our channel for more crucial health insights. Now, without any further ado, let's talk about the first sign. Why it looks harmless, but could quietly be a red flag for your brain's health. Number 5. New, unexplained problems with balance or coordination. It sounds simple enough. You suddenly fumble with your coffee cup, bump into a doorway, or feel a bit unsteady on your feet. The natural impulse is to think, my balance just isn't what it used to be. But here's what no one tells you. While age-related balance changes are typically gradual, happening over months or years, the effects of a silent stroke can feel more distinct. This isn't the slow decline of aging. It's a new, abrupt change in your ability. Imagine your brain is the command center for your body's movements. A silent stroke is like a small, sudden power outage to a specific control panel. If that panel fine-tunes your hands' motor skills, you might suddenly struggle to button a shirt. If it controls leg coordination, you might suddenly trip on a flat surface. Let me tell you about Robert, a 8-year-old retired teacher. He started noticing he was grabbing onto furniture to walk down his own hallway. He'd never had a fall, but felt a new sense of profound unsteadiness that seemed to come out of nowhere. His family dismissed it as old age. But an MRI later revealed multiple tiny spots of damage in his cerebellum, the part of the brain that controls balance, the telltale signs of silent strokes. Don't let a number on a calendar convince you that a new problem with balance is normal. If you or a loved one experiences a noticeable shift in coordination that seems to come out of the blue, don't dismiss it. Number 4. Brief episodes of confusion or trouble with words. This brings us to another sign that's dangerously easy to ignore: a sudden mental fog. Everyone has moments where they can't find the right word, but when it's related to a silent stroke, it's different. This isn't just about forgetting a name or where you put your keys. This is a sudden, temporary breakdown in your brain's language or processing center. You might be in the middle of a conversation and suddenly, the words coming at you sound like a foreign language. Or you try to speak, and a sentence comes out jumbled and makes no sense. It can pass in just a few moments, leaving you wondering what just happened. Here's the problem. Because it's fleeting, most people brush it off. But a 2019 study in the journal Times Stroke Times found that these transient cognitive symptoms were strongly linked to covert brain infarctions. It's a neurological event that needs attention. Take George, a 4-year-old who came to us worried about his mind. He'd been in the middle of explaining a simple recipe to his granddaughter when he completely lost his train of thought, unable to remember the next step or even organize his words. It lasted less than a minute, but it terrified him. That wasn't a senior moment. It was a critical warning sign that something was disrupting the blood flow in his brain. Number 3. Subtle, sudden vision changes. Have you ever experienced a sudden blurriness in your vision and thought, I probably just need to get my eyes checked? But a sudden change in vision can be a critical sign of a stroke, and it's one of the most commonly overlooked. This isn't about the gradual need for reading glasses. This is a sudden event. You might experience blurred or double vision that comes on for a few minutes and then disappears. Or, perhaps more alarmingly, you might lose a part of your vision, sometimes described as a curtain or a shadow falling over one eye. Because it's often painless and temporary, many people are tempted to just wait and see if it goes away. This is a dangerous mistake. Think about it this way. Your eyes are the cameras, but your brain is the supercomputer that processes the images. A silent stroke can disrupt blood flow to the occipital lobe, the part of your brain responsible for vision. When that happens, your computer screen can suddenly go blurry, show double images, or even go dark. If you suddenly have trouble seeing, it might not be your eyes at all. It could be your brain sending out a desperate signal for help. The information we're sharing today can be life-saving, not just for you, but for your parents, grandparents, and friends. If you're finding this video helpful, please take a moment to hit that like button and subscribe to our channel for more crucial health insights. And most importantly, share this video. Let us know in the comments. Has anyone you know ever experienced a symptom like this and ignored it? A simple click or a comment could be the action that helps someone you love recognize a hidden danger and get the care they need. Number 2. A sudden, intense wave of dizziness or vertigo. You probably didn't expect this one. A sudden spell of dizziness is incredibly easy to write off. We blame it on low blood sugar, dehydration, or simply getting up too fast. But a sudden, intense feeling of dizziness, or a sensation that the room is spinning, known as vertigo, can be a sign of a stroke, particularly one occurring in the back of the brain. So how can you tell the difference? Here's the uncomfortable truth. Dizziness from blood pressure drops often feels like lightheadedness. Stroke-related dizziness is frequently more severe and is often described as feeling profoundly unsteady, as if the ground is suddenly tilting beneath you. The most dangerous part is that it may not come with the classic stroke signs like facial drooping, making it even easier to dismiss. This happened to Dana, a 3-year-old grandmother. She was sitting in her chair when she was hit by a wave of vertigo so intense she couldn't stand up. It passed after about 10 minutes. She told her daughter she must have an ear infection. But when it happened again 2 weeks later, a doctor's visit and subsequent brain scan confirmed a small stroke in her cerebellum. If you or someone you're with suddenly feels dizzy and struggles to maintain balance for no apparent reason, don't just tell them to wait for it to pass. Pay close attention. It warrants an immediate medical evaluation. And now, we've reached the most insidious and most commonly misunderstood sign linked to silent strokes, and you've almost certainly attributed it to something else. Number 1. New or worsening difficulties with memory. When seniors feel more forgetful, the immediate fear is dementia or Alzheimer's. But here's the shocking truth. A significant portion of age-related cognitive decline may actually be caused by the cumulative damage of dozens or even hundreds of silent strokes over time. This isn't the normal tip-of-my-tongue forgetfulness. This is a more noticeable decline. It's when you find a familiar recipe suddenly feels like a complex puzzle. It's struggling to manage your finances when you've done it your whole life. It's a subtle but definite shift in your ability to problem-solve or learn new things. The problem is, these changes can be slow, but each silent stroke kills off a small piece of brain tissue. Think of it like tiny moths eating away at a complex tapestry. One hole is unnoticeable, but hundreds of holes will eventually destroy the picture. A major 2021 study in Times Neurology, Times followed thousands of older adults and found a direct link between the number of silent strokes visible on an MRI and the speed of their cognitive decline. Many, who were thought to simply have old age memory loss, were in fact suffering from progressive vascular damage. This is why paying attention to new or accelerating memory issues is critical. Don't just accept it. Pushing for answers could reveal an underlying vascular problem that, if managed, could help protect the brain you have left. What to do? Know the signs of a major stroke with F.A.S.T. Now that you know these quiet warnings, it's crucial to understand what to do if the massive earthquake does hit. Silent strokes are a major risk factor for a full-blown, life-threatening stroke. And for that, you must remember the acronym F.A.S.T. It's a simple test to spot a major stroke and reminds you what to do. F is for face. Ask the person to smile. Does one side of their face droop? A is for arms. Ask them to raise both arms. Does one arm drift downward? S is for speech. Ask them to repeat a simple phrase. Is their speech slurred or strange? T is for time. If you see any of these signs, it's time to call 911 immediately. Do not drive them to the hospital yourself. Paramedics can begin life-saving treatment the moment they arrive. When it comes to a major stroke, every second counts. So there you have it. 5 silent signs that may seem harmless, but can actually be the quiet precursors to a devastating health event. Let's quickly recap. 1. New or worsening difficulties with memory. 2. A sudden, intense wave of dizziness or vertigo. 3. Subtle, sudden vision changes. 4. Brief episodes of confusion or trouble with words. 5. New, unexplained problems with balance or coordination. These are the whispers that come before the roar. They are dangerously easy to rationalize as just another part of getting older. But now you know the difference. The key is the new or unexplained onset of these changes. Gradual decline over decades is one thing. A new, noticeable deficit is an alarm bell. Don't let a senior moment be a missed opportunity to protect your health. Listen to your body. Always ask why when you notice a new change. Your time, energy, and health are too valuable to waste on dismissals. You have the knowledge now. Use it to be your own best advocate. Now we want to hear from you. Have you or someone you love ever faced one of these subtle signs? What happened? Share with us your experiences in the comments below. We'd love to hear them. Thanks for watching.